On desaturating less than 88% with walk test as a predictor of survival, is this desaturation on room air or does it include patients already in oxygen? That's on room air. I'm of the suspicion that another surrogate measure is an increase in oxygen requirement, but that's a tricky thing to measure because of the uncertainty of how much you deliver by nasal cannula. But that Vilba-Lama study was on room air. You show an IPF-afflicted lung and an uninvolved lung next to it. Cannot the IPF lung be surgically removed to protect the clean lung? Cool. Unfortunately, when it's been looked at, it's a patchy exercise. The predominance of the disease is in the periphery, and there is sparing clearly of areas of lung. But an interesting study out of the National Jewish Pathology Group a number of years ago showed a lace interconnection between all of the fibroblastic foci. And so it's like a giant network throughout the entire lung. And really, we're talking about a level of severity in different portions of the lung. And so the question really is focused on a cancer approach, which philosophically isn't correct, except that the disease itself is more involved in that. What proportion of IPF cases involve the synthesis of collagen as the prime danger? I'm going to rephrase that or explain that in the sense that the very definition of this disease is deposition of collagen at various stages along the fibroblastic foci. That's actually what's happening. And so I wouldn't call it a danger. It's in fact what the disease is. In regards to the 6-minute walk test, has percent change in distance walked over 6 minutes been studied as a predictor of outcome? It has. And distance also correlates. No surprise. I mean, that's why that distance sat product has come into effect. Decline in distance is clearly a predictor of mortality, and Ron Dubois actually had that in his slide. The product may be a more sensitive predictor of either one, and then the SAT predictor, which is Vilba's study. Could you review general requirement possibilities for lung transplantation? We don't have a session on lung transplantation. I have some slides we can pop up at some point. You know, or I don't know if you, we can fix that. Yeah. I will make some quick comments, which is with the change in lung allocation scoring system, IPF moved to the top of the list, which was great because there were a lot of IPF patients that were dying on the list that are now being picked up and transplanted. And the real change in the lung allocation score was a recognition that oxygen requirement was a poor prognostic indicator along all transplant recipients, and it really shifted it up. Are any current clinical trials in the US for pirfenidone accepting patients? They are not. And you better believe that the company is holding on to that with a death grip at the moment because they really want to hear back from the FDA. And so I would exercise patience along that line. Are studies being done using CellCept in the treatment of IPF? That has been proposed. There is currently a study looking at scleroderma. The scleroderma lung 2 study is looking at CellCept in interstitial lung disease in those patients. But there is not currently one with CellCept.